Good evening, I'm Melisa Idris.
And I'm Sharaad Kutan.
Welcome to Consider This. Now, yesterday on the show, we had Dato' Abdul Latif bin Haji Abu Saman, the Director General of Malaysia Productivity Corporation, or better known as MPC. And he was on the show talking about how to make it easier to do business here in Malaysia. He's back on the show with us today, and he's joined by Dr. Jacob Thomas, Group Medical Advisor of Ramsay Sime Darby Healthcare. He's also the former president of the Association of Private Hospitals of Malaysia for the past 10 years, and he's just relinquished that role. Welcome to the show, gentlemen.
Yeah, thank you very much.
So today we're going to be discussing the Private Healthcare Productivity Nexus, which is the collaboration of the public sector and the private sector to increase the productivity of the healthcare sector. Now, Jake, I understand that you are the champion for this nexus.
That's right.
But before we get into that, I'd like Latif to kind of set the scene for us. I mean, there are 9 nexuses of productivity, right? Healthcare being one of them. Could you help paint a picture for us?
Yeah. Under the Malaysia Productivity Blueprint, which came into force in May 2017, there are 9 sectors that the government has given priority, and one of them is the private healthcare. Now, the productivity outlines very clearly. It is about looking at productivity as the game changer. All right, the economy needs to grow, and we're looking at productivity, to spur the economy of the country. So we have the 9 sectors. And these sectors, we have what we call productivity nexus. They are the center for productivity improvement. And these centers are led by what we call productivity champions. These are captains of industry.
Right.
They have got their own governing body. And for the private healthcare, we have got Dato' Jacob Thomas,
Who is the champion for
Yes.
the private healthcare sector.
And he's appointed by the National Productivity Council, chaired by the Prime Minister.
Okay, all right. So very quickly, talk to us about your role as champion.
Well, I'm to get together the various stakeholders, come up with the issues which affect productivity, and then find ways to resolve them. So that was a task which was given to me. So I was very fortunate that I was able to rope in the various stakeholders, private sector, public sector, industry, including agencies like Dewan Bandaraya, Bomba, Architects Association, and all of them together to come and see how can we improve the productivity of the private sector. So we got a lot of input, including from the Ministry of Health, and we were able to come up with different areas we need to focus on.
Latif, can I ask you about this, the objective? The objective, as you pointed out, is about spurring the economy, right? So these are not exhaustive. These 9 sectors are just the priority sectors. But the health sector is a curious one, and Malaysia gets even more curious because there is a public dimension to it, right? It's a public good in a way that perhaps other sectors might not be directly related to the lives of every citizen. There's also this other thing about the Malaysian healthcare system, which is that the government, through GLCs, is involved in the private healthcare sector. How do we make sense of this, that government is actually in the private healthcare system?
Yeah. You see, we like it or not, it has to be joint partnership with everyone, right? And you talk about public-private partnership. You see, we want people to do business easily in Malaysia. Now, healthcare is something that really touches heart of every Malaysian. Because if you make things difficult, you make people wait, longer, not just patient, even developers, is cost. It's cost. And cost will be passed down at the end to citizens. So that's why we need to speed up. We have to make procedures simple as much as possible. Investors are easy to come in and invest. Development can take place easily. Because if we are able to speed up all these things, it will help to reduce costs. At the end of the day, reduction in costs would also be experienced by public at large.
Okay, and I want to ask Jacob the same question really, which is to what extent, because it's often been said that the government in the health sector competes with itself. One, in providing public health care, and then through GLCs, through private initiatives, stakeholders, right? We have KPJ, we have even Ramsay Sime Darby has some investments from GLCs. Is the creation of a vibrant private healthcare system going to lead to the deterioration of the public healthcare system?
Of course not. because actually we've heard repeatedly by the government leaders, including the Minister of Health, that they want the private sector, private healthcare sector to take the lead. The government wants to sit back eventually and become just a regulator. And they want the private sector to be the one to provide healthcare centers, hospitals, and that is the way we are going through. So if you look today, the government of Malaysia is giving every possible encouragement to help the private healthcare sector to come up. And that is something which we are very happy about.
Why is it that this is private sector driven?
This because the government is a regulator. Okay. Ministry of Health is the one doing this. They've been trying many years now to do different things, but the government of today, just like the other 9 Nexus, have said we want the private sector to take the initiative to move this forward. And I must tell you that I am very, very happy and positive that this is going to work, because in the 2 years that we've been working on this, we've already shown a lot of results, a lot of improvements, and actually the main people who are saying this is something we've been waiting for and you guys are doing it is the Ministry of Health.
Okay, all right, so let's talk about that. So, you've been working on this for 2 years. Clearly you have had a diagnosis of the problem. Where are the pain points that you've identified that you can look to increase productivity within the healthcare sector?
The main area I would say is in the construction of a hospital. In the past, it used to take about 800 days for a private hospital to get permission to be set up. And this is because there was no coordination between the Ministry of Health, between the fire services, between the architects, and as a result, there was a back and forth going on. 800 days because, and you submit a plan and it goes back and forth. They've counted up to 17 or 18 times, and each of those periods takes about a few months.
Okay, so 800 days in the process of setting up a new hospital.
That's right.
It takes almost 3 years.
And you got this land which has been bought by somebody lying empty, something they paid for in big money.
Right.
Right. You have in your initiatives outlined 3 distinct areas, right? Workforce performance, technology and innovation, and regulation. We'll get to all of them in the course of the next half an hour.
20 minutes, all right. Well, let's come back and continue this conversation shortly on increasing productivity within the healthcare sector right here on Consider This. Make sure you stay tuned. Welcome back to Consider This. Melisa and Sharaad here with you, and we are joined by Dato' Abdul Latif from MPC, as well as Dr. Jacob Thomas, who's the champion of the Private Healthcare Productivity Nexus, a collaboration between the private sector and the public sector in increasing the productivity of the healthcare sector. Now, we've touched just before the break about the idea of making it easier for regulatory approval to set up hospitals. Within the regulatory framework of the healthcare sector, there's also, something that I discovered which was quite interesting, the reason why hospitals cannot be built above 12 stories. I never noticed it until it was pointed out to me. Latif, do you want to set the scene for us a little bit?
Okay. You see, we do have regulations in place, but over time regulations, may not be appropriate anymore. Yes. We need to review it. So I think in the last session I mentioned about the national policy on good regulatory practice. Regulations which are more than 5 years old, they are subject to review. So that is where I think we need to do a lot of engagement with the business community. They will tell you, how difficult to do business in Malaysia. So of course, like the private, private hospital, development private hospital, these are things that we engage with the private sector. They tell us. And when we do verification, with the regulators, which are basically the government agencies, yes, it says that you cannot be a hospital more than 12 stories. So it was interesting through the Nexus. I think they organized visit. They look at how other better countries They went over to, I think, to Hong Kong, and they saw that, that country could build 38 stories. All right? And we learned from that, bringing back here.
So this is an almost obsolete regulation, right? Because times have changed, equipment's changed, technology has changed. We're able to, I guess, provide more disaster management plans and have high-rise hospitals, which you saw, Jacob, in Hong Kong.
Yeah, actually, why the need came up, it's not just because we wanted a very tall hospital, because land became more scarce. And we had a luxury of availability of land in the past, but that got less and less. So we had developers in areas like Kuala Lumpur, Shah Alam, Johor asking, we want to build a hospital, but we don't have enough land. We want to go higher. So that's where the restriction came when you wanted to build a hospital higher than 12 floors.
Jacob, can I ask you, before this initiative and the work of the National Productivity Council kicked in, how was the process? I mean, surely industry was going to government and saying, there's too much red tape, these laws are obsolete. Were your criticisms or your feedback falling on deaf ears before that?
It was. I must say that, I can bravely say that, because I was the president of the Association of Private Hospitals.
You were giving the complaints.
We were giving the complaints, saying it is too rigid, you are not listening to us, these are laws of 1971, or it doesn't apply today, we need changes, but it just fell on deaf ears, as you said. But now, I am sitting as a person from within, with the support of MPC, and if you go all the way around, it goes right up to the National Productivity Council, which is headed by the Prime Minister, who's listening, and they have said, we will work around the issues you have, because productivity is the end game. And so, because of that, people are listening, and changes are being made.
Okay, well, it also, I guess, because he's a medical doctor himself, perhaps.
I do want to ask, though, is change only possible or enabled when we have the Prime Minister's hand in the mix? I mean, is Malaysia one of those countries where you can't have initiatives and good sense emanating from middle-ranking officers or even from the ground up? Why does it require the Prime Minister to be there in order for change to happen?
I think people want to change, but at times they don't know how to change. Now we come in to facilitate. So what we do is that we do verification. We hear complaints, all right, and then we gather all the information. We do verification, all right. We map out the whole process, and then we start asking and compare with the best practice elsewhere. And then we realize that we do have gaps. We do have unnecessary regulatory requirements. So we started challenging and bring all these different people and ask ourselves, can we change? But we have to work, not just among us. So the private sector together with the government. The private sector will tell you real issues that they face. Okay. Government may not know because government just introduces regulation. So we have to bring them together, and we realize that we can change together.
But I must say this, even before it reached the Prime Minister, before that, I had to go through the Minister of Health, I had to go through the MITI Minister, I had to go through the MEA Economic Affairs Minister. They all thought that we had valid points, and they endorsed it. And by the time it came up to the Prime Minister, it was quite certain that we had the support of all these people, but he stamped it because I think he could really see how much it was needed, and he supported us fully.
I want to come back to a point that you made, Latif, about the government being the regulator, right? Healthcare is, I guess, a different type of animal because, again, as Sharaad talked about, it's a public good. Now, the government's role as regulator, in the healthcare sector, is again to safeguard, the public's interest. While listening to feedback from the private sector, not necessarily just profit-driven, I'm wondering in the area of, say, for instance, one of the things that you brought up, Jacob, in your I guess, recommendations to the government is a relook at the private healthcare advertising landscape. So the idea is to have a more self-regulatory system as opposed to, black and white. Can you tell me why this is an area that is going to benefit the public? So why should the government loosen regulations on healthcare advertising?
You see, the main issue affecting private hospitals is the delays when it comes to applying for permission to advertise. The regulations here are very strict, whereas when we look at our neighboring countries, many of them self-regulate, which means that if I want to come up with an article in a magazine, it has to be vetted by the division in the Ministry of Health, and that could take some time. And then they say okay, and then if you want to change it, you have to go again and spend time to get that done. So what we are saying is, why do you want to do it? And that division finds it difficult to cope with the volume of work. So we said, we will self-regulate, you give us the guidelines, you give us the criteria, we will follow that. If we flout that, then you come after us.
Is there an area where the public's good is the public's
because
interest?
what is happening is, if we don't advertise, there are Malaysians who are going to neighboring countries for treatment, and when they go there, they are told, hey, your hospitals have got the latest. They don't know, and we are not allowed to advertise.
So I'm wondering if this is the best way to understand what's happening, that we are looking at the increased productivity of the Malaysian private healthcare system in relation to the global provision of services, right? And so the question is, are those global standards the ones that we want to peg ourselves to? Where are they best, and where they might in fact be so loose as to not protect the public?
I would agree there that we don't want to say it's free for all.
Right.
We want to have certain restrictions. That's why I say you have criteria, you have guidelines, we follow them. We don't want the public to be hoodwinked and say you are the best, you are the... But if you have something which you want to shout out, tell us. One example I'll give you is, if you look at the websites of some of our neighboring countries, you have, every patient, whichever country he comes from, wants to see the face of the doctor, and we are only allowed to put a passport size photo of our doctor. Whereas if you look at some of the neighboring countries, you have a doctor sitting on a couch looking good, and he gets a lot of patients, and he is a plastic surgeon. So why not let our doctors have that privilege? Why restrict it? In fact, when I brought this up to the Prime Minister, he did agree with me that we have not changed from those early days where we restrict the amount we can advertise.
So doctors will be allowed to smile. I think it's very important. They'll be allowed to smile.
Not just the
And we have got
mugshots or the passport
size.
photo.
Wonderful. Okay.
We're going to come back and continue this conversation on Consider This. Make sure you stay tuned to Astro AWANI. Thank you for staying with us on Consider This. Melisa and Sharaad here, talking about how to increase productivity in the private healthcare sector. Well, let's take a look at workforce, because that is an issue that you feel very strongly about. The last time you were on, you talked a lot about workforce, Latif.
Yeah.
And I want to discuss the issue of workforce in the healthcare sector, because again, there is, the stock take is that there is a lack of specialists within the healthcare sector. And the assumption is that the private sector trains all the medical minds, of our country, for them only to leave to go into the the public sector trains for the private sector. Latif, would you mind telling us how MPC is looking to address this?
You see, in every economic sector, you're bound to have issues which are considered common, right? Of course, labor or workforce is always an issue. Whether you're in electrical, electronic, you're in construction, so it goes also for the private healthcare. Now, we have to look at whether, as you put it rightly earlier, regulations, when they were introduced, they are with a purpose, when they were put into place. And we want to make sure that, regulation ensures safety, security, of citizens, at the same time ensuring that, environment is also protected, for citizens of Malaysia. We talk about welfare, of Malaysians and all that. Now, the same thing, we have to look at, on the issue of workforce. Now, of course, we talk about shortage of expertise, experts in some areas and all that. So we have to look at regulations that we have in place. Whether regulations that we have, do these regulations facilitate or, again, as I've said I think earlier, frustrate? Are they obstructing? Because we need to ensure that regulations ensures that people find easy to do business. So the same goes for the private healthcare. So what we did is to engage, all right, with the practitioners out there, the private sector. They will tell you about regulation. They will tell you what are the requirements and all that. Now we have to do verification. Then we do engagement, all right, with the public sector organisation or the authorities that oversees some of these issues. So that's why through this nexus, you have got the private sector people there. These are practitioners, people who understand issues on ground. And again, as I've said before, we engage, with the government or with the public sector, we need to do verification, we need to have substance, we need to have information, so that whatever decision that we make is going to be a well-informed decision, taking into account all factors that I've mentioned:
right.
Safety, security, environment, welfare. Right?
Okay, Jacob, jump in there if you can, and tell us about how the workforce performance issue really plays out in the private healthcare system. What exactly are the deficits, and where is it that things need to change, especially where government can help enable that change?
Actually, there are no specialists being trained today in adequate numbers for the private sector. So our easy way is to look at senior doctors from the public sector who are willing to come and join us. But we feel today our private hospitals are well developed and able to train good specialists within the private sector itself. So what we want to do is to take medical officers who have already been trained, finished their housemanship, take them into the private sector, either to become an ENT specialist or an orthopedic surgeon, put them to a training program where they can continue to serve us. Now, this might also mean that the private sector will take it on themselves to send this specialist or this medical officer abroad to get some of his training and bring them back and continue to work with us, and we'll be self-sufficient that way. So we can decide which specialists we want to train.
So what stopped the private sector hospitals from doing that in the past? I mean, is this about certification? Is that what is preventing this from happening?
We have not been allowed to, we were not, the programs which were developed or beginning to be developed were not fully approved. So we want them to be approved. So we are beginning as part of this nexus to work with universities and to look at, can we come up with a curriculum which is approved by the Ministry of Health, by the universities, by everybody, so that when this specialist comes out, he is ready to go anywhere in the country, be it the public sector or the private sector.
Okay, so it's not to the detriment of the public sector.
No, we don't want to
shared.
pinch,
Okay.
because there's enough workload for these specialists in the public sector, and we don't want to take them out.
Understood.
And so that's the reason.
So workforce is one area where the public and the private can share. What about equipment? Can is that also an area that
another
can be shared?
main issue which we are looking at. If you look at some of the equipment technology you have in some private hospitals in some states in the country, they have too many and it is not being utilized fully. So there is no productivity. You have an expensive piece of equipment which is not fully utilized. The hospital loses money and you want to utilize it more. So we are looking at public-private partnership to utilize some of this equipment, and also private-private partnership where one private hospital can share a piece of equipment with another private hospital. So that is what we are moving toward.
Very quickly, what prevented this from happening? A referral letter could have been issued in the past, could it not, for people to go to another hospital to get it?
Well, it was not thought about. Every hospital
Competition.
thought that if you don't have a MRI or a CT scan, you're not good enough. And so we wanted this thinking to change.
So this is about branding the hospital.
That's right. And oh, that hospital doesn't have an MRI or that hospital doesn't have a CT scan. But we have a situation where in some states that far too many, 7 or 6 PET scans where each one is not, and so we are talking about productivity here. how much are you going to use that? And it's huge monies being spent.
Ensuring that the productivity of that machine is maximized,
Yes,
right?
that's right.
Unfortunately, gentlemen, that's all the time we have for the show tonight. It's been such a pleasure speaking with you both. Thank you for being on the show.
Thank you to
It's
you
our
too.
pleasure.
Thank you
Thank
very
you.
We'll
much.
be back with another episode of Consider This same time tomorrow. I'm Melisa Idris, with me Sharaad Kutan, signing off. Thank you for watching. Good night.